More affidavits were filed in the state of Ohio. More pregnant minors who were raped denied Ohio abortions. The affidavits were filed in Cincinnati as part of a lawsuit aimed at stopping enforcement of Ohio's strict new abortion law. Let's go through some of the cases that were filed. At least 2 more minors made pregnant by sexual assault were forced to leave Ohio to avoid having their rapists' babies. Aaron Trick, the operations manager of Women's Med Center, told of a 16-year-old girl living in southwestern Ohio who had become pregnant after being sexually assaulted by a family member. This teenager was forced to go to Indianapolis for an abortion. The local Ohio law enforcement agents then had to drive to the Indianapolis clinic to retrieve tissue for crime lab testing. So not only are these bans traumatizing victims, but they are also hampering law enforcement's ability to investigate and prosecute. The descriptions include those of 3 women who threatened suicide. Another 3 documents were submitted of women whose fetuses had severe abnormalities or other conditions that made a successful pregnancy impossible. One patient had a fetus with abnormalities including a lack of lower extremities and the contents of the fetus's abdomen, including possibly the heart, protruding through a defect in the abdominal wall. She was not allowed to abort unless the pregnancy posed an imminent threat to her health. A pregnant 25-year-old went to a clinic operated by Planned Parenthood. The patient had recurrent cancer and was undergoing chemotherapy when she learned that she was pregnant. The clinic determined that she was 8 weeks pregnant, and workers there said they couldn't perform an abortion. The patient had to travel out of state for an abortion to resume her cancer treatment. A 37-year-old woman suffering stage 3 melanoma was told by her doctors that she had to terminate her pregnancy before they would treat her, but she couldn't get an abortion in the state. 2 patients at the clinic said they had tubal or ectopic pregnancies, but the doctors at emergency rooms were afraid to treat them without being absolutely certain there was no intrauterine pregnancy. Because ectopic pregnancies don't always show up on the scan or can be implanted on a cesarean scar within the uterus, they needed to delay treatment in order to get extra confirmation. In one case, while treatment was delayed, the patient's fallopian tube ruptured and surgery was needed rather than medical management. The documents were filed in the case Preterm Cleveland versus the Ohio Attorney General Dave Yost.